We are in Dublin, Ohio at the headquarters of Cardinal Health, visiting with Cardinal's chairman and chief executive officer, Mr. George Barrett. Well, of course, many industries are in the midst of massive change, including yours, the healthcare industry. How critical is it amidst that change to reinvent a company, and how do you recommend a management team go about that reinvention?
Right. Well, the word reinvention is used a lot these days and probably means a lot of different things to different folks. I think for us, this is a time of extraordinary change. It is for many businesses, but certainly those of us in healthcare realize that we're in a system that's undergoing a lot of unique pressures. You've got enormous population health issues. You've got still a large number of uninsured or underinsured Americans. You've got issues of public health and issues around demographics that are really creating a huge challenge when you think about the economic impact for us. And so we've thought a lot about the sort of the reinvention of the company, and I think all companies need to do this. I think the constant evaluation of where you are, what your portfolio looks like in the midst of change is a critical thing for us. So we've devoted a lot of attention to this. We've created a strategy council that meets regularly. Rather than thinking of strategy as sort of a unique moment in time once a year, it's an ongoing process for us. We've talked a lot about the notion of innovation and how innovation in a service business is actually just as important as innovation in a product business. We all tend to think of innovation as the iPod, for example, or a product, but in a business undergoing huge change, in a system undergoing huge change, innovation can also be thinking about different ways of doing business. And what we think of as business innovation is just as powerful as product innovation. So at a time of huge change, we've tried to create a culture in which people are both executing on day-to-day blocking and tackling, but also thinking about some of those changes and how we need to compete in a world that is going to probably look somewhat different than the world we have today.
Right. Well, you mentioned that you try to look at that situation often. How often do you have to meet in order to stay on top of this and not let it pass you by?
Well, there's sort of two answers to that question. One is that I think it's really a continuous process. So I think strategy is not a moment or an activity or a department. It's a process that you embark on all the time. We have certain ways of governing our organization that help us with that. So, for example, our executive committee meets every week. Now, again, those are not always the big, compelling strategy discussions,
right.
But every week we touch on things that really reflect, or at least are very related to the strategic direction for the company. As I said, we created a council that does meet at sort of regular intervals, and that can be episodic, but probably in the last 4 months we've met 5 times. It just allows us to make sure that we're surfacing the issues that don't exist in the everyday dialogue. And that's really important. You never know what is happening on your periphery unless you actually get a chance to surface those issues and discuss them. So we regard this as a pretty active process, and we engage our board in this discussion as well.
Right. Does your board have a strategy committee that meets regularly to assess these things, and do you think that that's a good idea for boards across the landscape?
You know, some boards do. Actually, to me, the board is the strategy committee.
Okay.
And so what we do, and we've been doing for a number of years now, is we actually, at every one of our board meetings, we touch on certain strategic issues, but we also set out a separate strategy retreat, in effect, where we really do not discuss the day-to-day operating performance, but we really focus on the big issues of our environment, of our core capabilities, and how those two things are aligned, and what we need to do strategically. So we really have a series of steps. We actually do it in a bit of a 2-step process where we surface certain issues, we spend a day reviewing critical strategic aspects of the business, and then in the next few months we actually come back based on some feedback with the board and we revisit some of those key issues and chart course. So for us it's a very important dialogue between the management team and the board of directors.
Now, Cardinal is big, over $100 billion in revenue, but you still manage to move pretty quickly.
We're trying. It's not always easy. I describe this as a force of gravity. I do think that there are certain things that come with growth and with size. They're almost gravitational pulls. You don't even see them happening, but they happen. You have a tendency to get slower, more bureaucratic, a little more hierarchical. I think that is an insidious creep that can occur with all companies. And so my perspective is that if it is a force of gravity and something you don't see, you have to actively fight it all the time. And so that's a constant battle that we wage to make sure that we're nimble, that we're fast. Healthcare is moving in amazingly quick darts. And so for us, it's very, very important, in spite of our size, to be able to move quickly, to be able to assess and move fast. And so you just try to create a culture in which people understand that we have to fight those gravitational forces. You've got to model the behavior you want. You've got to be able to move quickly. You can't spend all your days in meeting after meeting after meeting. You've got to be able to say, look, we're going to move. We're going to set some tight timelines and move quickly. So on the one hand, as a big company, you've got to make sure that you're governing yourself with the right controls, but you have to remain nimble. And for me, it's partly surfacing that as an issue for our team and for the entire organization to say, look, we're big, but we're going to have to be extremely agile.
Well, a lot of companies talk about the health and well-being of their people, but Cardinal has been recognized for this as doing a good job at it. What are the keys and how important is it to have a healthy and happy workforce?
It's enormously important, and actually for us it's both important in substance and in symbolism. We're a business that talks about bringing cost effectiveness to the healthcare system. It's very hard to say that and then not live it as an organization.
Right.
And part of the issue that we face, there's plenty of discussion, as you know, about the effectiveness of our healthcare system. We need to be more integrated. IT systems need to be more linked. Care needs to be more coordinated. There are all kinds of issues that we've talked about in the health systems. Incentives probably need to be more effectively aligned. That's one side of the equation. The other side of the equation is people taking ownership of their own health, our own wellness. And we've tried to make that part of our discussion with our own employees and part of our life here. So we incentivize wellness. We make it easy for people to participate in those things. We've got a health center that we subsidize that helps people get access to the opportunity for exercise. We've changed our cafeteria offerings so that we've got more healthy choices for people. We've made available the tools to help deal with weight management and smoking cessation. So I think tackling those community health issues are very important for us as a society. And as a business, we know that when we have a healthier population, they're happier, they're more productive, and actually it's more cost effective for us because we don't have as many people going to the doctors. So that there's an economic imperative to do this as well. So we're beginning to, it's early, this data is always tough to grab, but we're actually beginning to see data that says our population is getting healthier and that's reducing our medical costs. And so there's a powerful public health issue here.